Hey guys, so in today's video, I thought that I would take the time to respond to some comments. This is actually just one comment, um, but this was left on a recent video that I uploaded titled Holter Monitor Torture, Dexcom G7, and Water Flavor Unboxing. So this was left by Joanna719, and I'm going to read her comment and then I'm going to respond to it. So she says, what do you think about people working as a medical assistant who didn't go to school for it? I get confused because I have heard some people say you don't need to go to school for it, but maybe it depends on which state you live in. But every medical assistant I know went to school for it before working as one. I would think it makes sense going to school for it because I wouldn't want to start giving people shots and stuff without having the education for it first. Okay, so I think there are a couple of important points to mention here. So I personally would also not feel comfortable working as a medical assistant if I did not have the training and education. However, let me just say that I don't think that any good, reputable facility or clinic is going to allow someone who has no prior experience and no training as a medical assistant just do injections and things like that. So I just want to say the hospital that I work at, we actually have a medical assistant training program currently, and they just did one class last year, and I think they're accepting applications for the class this year, and I think they end like next week or something, the application cycle. But basically, these students are offered a job, they're getting paid to learn. Um, they don't necessarily have prior experience as a medical assistant, but most of them that applied last year had at least some sort of healthcare experience. There were a couple that didn't, but they're basically getting paid to do on-the-job training, if that makes sense. So these people that are accepted into this program, they do not only on the job training, but they go through and do like book work and schoolwork and all of that stuff to go through a regular medical assistant training program. But then they work with another medical assistant or one of our clinic LPNs, and they basically get orientation where they're kind of supervised and training. They're not allowed to give injections until they have gotten that certification and gotten trained in doing so. They're not allowed to just do things by themselves until they've had proper orientation and training. And I think that that's important because injections can be very dangerous. You could potentially injure someone if you do it at the wrong angle, if you inject something that should be sub-Q and you inject it IM. Depending on what the substance is that you injected, you could really hurt someone. And if you go in at the wrong angle, you could definitely hurt someone. So I think it's important that everybody get that extra training. Just like I wouldn't expect somebody, to go and draw blood if they've never learned how to do it. I would not expect that someone would know how to do that. It's dangerous and you could really hurt somebody. You could hit an artery and not like the person could bleed and bleed and bleed if you hit an artery. You have to be really careful. And I think hopefully there are enough reputable facilities that they would make sure to take the time to, you know, understand and allow these students to learn and fully learn the proper job duties. I definitely think that education is important. And, I will be the first one to tell you that I love seeing people get education in healthcare, whatever the case may be, whether that's CNA, phlebotomy, medical assisting, whatever. You guys know I have multiple certifications and I have kept them all active. Excuse me. I feel like next month my CNA certification expires, but I have to go online and just request for it to be active. And that's a simple enough process. So I don't really know what else to say other than that. Just that I think that it's important that even if you didn't necessarily go to school for your medical assisting, that you're going to work at a facility that is going to give you enough training, because I don't think it's fair to the person who doesn't have that experience either to just kind of throw them to the wolves and expect them to be successful. Because healthcare, especially working as a medical assistant, like if you're in an outpatient clinic setting or, any type of clinic setting as a medical assistant, it can get crazy. There are days that are super calm and you're able to kind of go from one to the next and not feel like you're running around like a chicken with your head cut off. But there are days, like yesterday, I was working in the urgent care clinic and it was insane. We were like nonstop going. I think there was maybe a 20-minute span of time where there were no patients checking in, nothing was going on, there was no craziness. But for the rest of the 8 hours or 8.5 hours that I was there, it was just crazy. So, there are days like that. And then, like I said, there's days where it's calm. And I feel like if you've never worked in healthcare, you've never gotten that training, you've never worked as a medical assistant before, you need to kind of ease into that sort of thing. And I don't think it's fair to the person to just expect them to know everything either, because there's a lot of different knowledge and different skills that you need to know as a medical assistant in order to be successful in your daily job responsibilities. So I don't necessarily think that there's anything wrong with not going to school to be a medical assistant, but I do think you definitely need training. Um, I think a lot of places are leaning more towards hiring people with certifications just because they want to know that they don't have to like train them all the way. But I also feel like getting somebody who's new and fresh as a medical assistant allows employers to kind of mold them into the type of medical assistant that they need the person to be. So I can definitely see why companies would prefer to have somebody who doesn't necessarily have experience. But then again, I also feel like a lot of employers would value somebody who has experience just because they don't have to do as much training. So I can see it from both sides there. Um, but like I said, I feel like if you're going to work as a medical assistant with no training, no education, things like that, there are certain things that I don't feel like you should be able to do until you've had the proper training. Like for example, when I first started as a medical assistant, I didn't get any clinical training, and I made sure to let them know at my interview that I didn't get a clinical, because when I went to medical assistant training, the school that I went to, this was during COVID, and the clinics around were not really accepting externships at that time. So I never got an externship. And I just let them know when I interviewed at the hospital that I work at, that I didn't get a clinical externship, but I had worked as a CNA for multiple years beforehand. So I had worked in healthcare. And I think that that sort of helped me get the job. But, yeah, I don't know. I feel like you have to be honest, but you also, like, when I started there, they made sure that I had all the training. I did not work alone for like 6 weeks. And, I got all of the training. I got lab training, even though I didn't necessarily need it because I was certified as a phlebotomist separately from my medical assistant training. Um, I did lab training. I got wave test training separately from the lab training. And then I got training on doing TB skin tests. I actually had to do a separate certification class for that because that's what the state of Michigan requires. Um, I got training in doing injections. I had a whole list of things that I had to have checked off as being able to do by my preceptor before I was able to be on my own. And that included things like rooming, doing vitals, and, going through and checking medication lists and, making sure that I'm doing things properly. So I feel like as long as the employer has that sort of orientation process in place, then I feel a lot safer. I also feel like it's important if you have a preceptor who you can go to ask questions and, trust that they have yours and the patient's best interests at heart, because that definitely matters as well. So anyways, I hope that answered your question. I know that was a long-winded answer, but that's kind of why I wanted to answer this comment on its own, because I felt like I was going to get a little long-winded with that one. So anyways, hopefully that answered your question. Let me know if you have any other questions. I'm always glad to answer. And with that being said, I will talk to you guys next time.